The cloud. Okay, so I am going to admit all, if everyone's okay with that.
Good evening, everyone. Before we begin, I would just request all the participants to mute their microphones. We'll be taking questions as well. At the end of the webinar, you can type your questions in the chat and we'll make sure that we answer most of them as much as we can. So I'll give everybody a minute to settle in and then we'll begin. Thank you. All right, I think we can start. Good evening, everyone. My name is Dania Lasad. I'm one of the vascular neurologists here at Hartford Hospital, and I'm also faculty at the University of Connecticut and Hartford Hospital Neurology Residency Program. We are all very, very excited to share why we love our program so much, and we are so excited that you're interested in applying to our program. We have a bunch of our faculty and our residents who have joined you on a weekday because that's how excited we are to share about our program and tell you why it is that we call all of us consider each other part of the UConn family. So welcome, everyone. As I said, that we'll be answering your questions in the chat. So please feel free to type your questions. And without further ado, we will start with our program director, Dr. Erica Schuyler, who'd be giving you an overview and obviously welcoming all the people on this webinar. Dr. Schuyler.
Great. Thanks so much, Dr. Asad. Welcome to our open house. It's really exciting to get this recruitment season started really soon. I know applications open in I think next week already. So we're really excited to get started meeting our future neurologists and starting to recruit our class for next year. So I just wanted to say a brief hello. Most of the time is going to be content given to you by our amazing faculty and our residents in our program. I have been our program director for this residency program since 2009. And so many of the faculty that are joining today actually completed residency training at some point in our program. And so that's one of the things I'm very proud of. We've had so many amazing graduates of this program go on to do take positions both within our institutions as well as all over the country, all over the world, and are really doing some great things. So the goal of our program really is to train competent clinical neurologists that will be prepared to basically face any challenge. So basically, whether it's a subspecialty fellowship, general practice, any type of track that you're thinking about, we want to mentor you through the process and get you where you want to be after residency. So we have a bunch of slides that, excuse me, that our residents and faculty are going to go through just to highlight some aspects of our program. And I hope that you'll enjoy it. Type some questions in the chat. And I hope that you read more about our program if you're interested on our website, follow our social media, and get as much information as you can. So welcome, and we're glad to have you here. Am I doing this slide?
Yes, Dr. Schuyler.
Okay. So as you probably know from our information, we have a total of 8 residents. We're categorical, so you only need to apply to one program. We don't have a linked medicine program. All of our slots are 4-year categorical programs. Our primary rotation site is at Hartford Hospital, which is a 1,000-bed, approximately teaching hospital in Hartford, Connecticut. You'll learn a little bit more about Hartford and Connecticut with tonight's program, but it's an amazing place to train. Every time I work on service, I see something I haven't seen before, or more than one thing I haven't seen before, and that's in working for almost 20 years as being an attending. So it's an amazing place to train. We see a lot of, emergency cases, acute care cases, tons of stroke treatment, managing status, all kinds of acute emergency things. Our Neuroscience Institute, we're also treating a full range of, subspecialty care within neuroscience. Our residents also rotate a good part of the time at UConn in Farmington, which is only about 10-15 minute drive away. That's where the continuity clinic is. But it's great that we have two sort of separate hospitals where our residents really get great diverse experiences in neurology. So and we have a few other hospitals, Connecticut Children's Hospital for Special Care, where they do rehab and some neuromuscular specialty training. And really, you'll hear more from our speakers tonight, but really just an amazing, just diversity, breadth, and depth of cases that we're seeing across the subspecialties. Our faculty are just really enthusiastic, love teaching, and our residents are involved in many different, interests, activities, subspecialty interests, and it's really just a great culture. So can move on to the next slide.
So the reason I'm presenting this is because this is something that I personally, as a former resident of this program and now faculty, take immense pride in. That for more than 3 decades, I feel that our program has been the highlight of DEI efforts, even before, these were things that were incorporated into a lot of sort of programs and institutions across the country. What we pride ourselves in is, and as you can probably see from the panel, that people from different backgrounds, different training backgrounds, different kinds of sort of medical training backgrounds join our program and become part of what we call the UConn Neurology family. So as you can see that we have our program, as Dr. Schuyler said, has 7 residents per class, usually from all over the world, which is true for almost every class that we have for our fantastic residents, even this time around. And we have 50 plus faculty and constantly being added across Hartford Hospital and UConn are 2 sort of major sites from many countries and different training backgrounds. So that is something that we are immensely proud of. And we are looking for people who are a perfect fit in this diverse and inclusive program. So we're excited to have you guys interview with us. Next slide, please.
Hi, everyone. My name is Anvesh. I'm one of the chief residents at UConn Neurology in Hartford Hospital. I think something that struck out to me when I was interviewing for residency in general, and something I sort of valued as the process went on, was what is the retention rate of the residents and how many of them stayed back as faculty. And as you can see from this slide alone, I won't go into the details, is that there's a lot of our prior residents that stay on as faculty. Some of them stay in our fellowships as well, and some of them like it so much that they do both. And these are people that you'll work with in your continuity clinic, in your subspecialty clinics, as well as the inpatient sectors as well. And these are attendings that will train you even from PGY1. So I think that's something that's really unique about our program. Dr. Benshaya is here as well. I think she can share some more information as well.
Hi, everyone. My name is Sarah Benhaya, and I'm also one of the former residents. I graduated in 2018, went for my fellowship, epilepsy fellowship, came back as a faculty. And in my time, we were 5 residents per year. Out of those 5, 4 of us came back, actually 3 of us, and 1 of us stayed as a fellow. So a class of 5, 4 of us stayed for the coming years. One of the reasons why it was so important for us to come back, it's just the atmosphere of the program. Everybody's very collegial, and it's good to work as a team with all these people. And also because in different areas, everybody is really committed to provide the best care, as well as committed to education. So it was a great place to find a job and, think about staying here for long term. Next slide, please.
Welcome, everyone. My name is James. I'm one of the PGY2 neurology residents here. And just for a quick blurb about me, I grew up in Connecticut. I went to undergrad at UConn and then medical school at UConn. And I thought I liked it so much, I was here for round 3. But one of the things we want to talk about with this presentation was an overview of our PGY1 year. You know, all of us are applying to, or all of you are applying to neurology, and obviously the goal is to get into neurology year as soon as possible. But I think the PGY1 year is actually really valuable as well. It builds the baseline for the tools that you have to succeed as a resident. And I really enjoyed my first year even more than I thought I would. So just for a quick overview on, you know, the breakdown of weeks, the majority of the weeks are based in medicine. So we do like 5 blocks, 20 weeks on the inpatient ward service. There's also 8 weeks in the medical ICU. And then also we get a good introduction to neurology as well, with 4 weeks on the neurology service and an additional 4 weeks on the neuro ICU service. So yeah, overall, it's a excellent year. And then as some of my colleagues know, I was actually playing pickup soccer with some of my buddies from the medicine cohort just earlier today. So it was a great experience, and it really helps incorporate into the culture of the hospital.
Thanks, James. Hello, everyone. My name is Shri. I'm also one of the PGY2s with James. And like him, I'm also a three-peat at UConn undergrad medical school, and I loved it, so I stayed for residency as well. I think he mentioned a lot of good points about PGY1, where you make a lot of good connections, and I've made some of my best friends in residency so far during my PGY1. And at the end of PGY1, you have what's called the neurology boot camp. So you spend about a month, and it's the entire month of June where you get to know the faculty. It's really low stress. You get to spend a lot of time, you know, going to stroke codes, understanding the workflow of the situation. It's a very nice transition from your mindset that you have in PGY1 in medicine, and you get a whole month of getting your mindset ready for PGY2 and for neurology. So at the same time, like I said, it's low stress, so you have a lot of wellness, you have a lot of free time. So, you know, you get to spend some time learning, you can spend some time teaching, you might run into some medical students as well, and you get a lot of time in simulation. You know, both UConn and Hartford are known for their extremely well-equipped and, you know, renowned simulation and skill sessions. And we spend a lot of time, you know, practicing stroke codes, practicing how to deal with status epilepticus and lumbar punctures and whatnot. So additionally, there's also, you know, long calls where you get to spend some time with seniors to really understand what it's like to be a little more independent. So not only do you start having that early exposure to neurology at the end of PGY1, but you have some time to grow that independence early as well. So I thought it was a fantastic month. We can go to the next slide.
All right. Hi, this is Anvesh again. Quickly, we can just talk about the sample schedule that all the 3 years encompass. PGY2 is the junior resident year. It is fairly front-loaded, and it serves as basically your building blocks for your senior and chief years. It's a mixture of more inpatient neurology and consult neurology, interspersed with about 4 weeks of night float. I think the unique thing I felt about intern year was how the neuroradiology, the EEG rotations were sort of incorporated in the block schedule itself. So these are dedicated weeks where you are reviewing imaging with the neuroradiologist in the morning, as well as reviewing some EEGs with the epileptologist later in the day. And then the other important week was your interventional radiology week. So where you're spending time in the neuroangiography suite with the endovascular attendings. And early on in your PGY2, you sort of understand what are the semantics and logistics that sort of take place when patients go for thrombectomy, how the diagnostic procedures are done. And then this block schedule for the PGY2 year sort of sets space for how you serve as your senior residents when you move to your PGY3 year, where we have dedicated weeks for EMGs and EEGs. So that's protected time for you to review EEGs and take it a step further under the guidance of an epileptologist. Furthermore, there's about 3 months of pediatric neurology that is sort of spaced out towards the year. And we start doing what's called day flow, where you sort of come in the afternoon and sort of pick up bits and pieces as to what's left. And that's where you start enjoying your independence that you start building towards the end of the junior year as well. And transitioning to your chief year when you're a PGY4 resident, you start to take over service, you're responsible for your junior residents. So that sort of consolidates around 16 weeks spread over the inpatient and consult neurology services. This is separated across our 2 sites. In addition, we do some more day float weeks, like I mentioned, that is again from PGY3 as well. And this is when, this year is when you're also doing our psychiatry and neuropathology weeks. So overall, if you look at it, there's a stepwise fashion where you see your growth taking place, and you can sort of enjoy your autonomy from the PGY2 to PGY3 year. And PGY4 year is when you start taking over service and start training your junior residents and start thinking as junior faculty. I think going through the schedule, I've sort of understood that it is proven and it's sort of efficacious. But yeah, we can move on to the next slide for
Hi everyone, I'm Alicia. I'm also one of the PGY2s. I also went to UConn for med school along with Shri and James. So I'll just briefly go over our scheduling highlights. So we have day float, which is basically an extra senior resident that helps out during the week, Monday through Friday, with either the inpatient team or consult service, and just to kind of help basically provide help where they're needed. If the inpatient team is super busy with stroke codes or admissions, they'll help out there. Or if the consult team's overloaded, they'll help out there as well. So it's really helpful to have an extra person there for support. We also have a buddy night float system. So as a PGY2, we'll work for 3 weeks with a senior resident for night float. And then at the end of PGY2, we do 1 week alone. But early in the year, we have a lot of support, and we have the senior with us to kind of go through how the night float works, and just to have extra help and support throughout the night. We have long call as well, which starts at 5 p.m. And it goes until 8 p.m. And the day float resident is there, so you're not alone as a PGY2. You have someone there with you. And night float resident usually comes in at 8 p.m. and then they'll take over for the night until the morning. And like I think Anvesh mentioned earlier, going through the block schedule, we do have a lot of early outpatient and elective experience. I think I'm only like 2.5 months into my PGY2, and I've already done 3 weeks of subspecialty and elective in separate blocks. But I think we get a lot of exposure to other subspecialty clinics. I'm currently doing my neuro IR rotation, which has been a lot of fun, and I think it helps me understand the thrombectomy and DSAs and all of those things early on, so you can learn as you go when you're back in your stroke rotation or anything like that. It's been very helpful. So yeah, a lot of experience outside of just the inpatient unit. And I'll pass on the slide to Pooja next.
Hi everyone, I'm Pooja. I'm a PGY2. I'm from India. I did my med school over there and I came here for residency. My slide is about the resident education. I think coming into PGY2, you understand that the learning curve is pretty steep, and I think the program is very cognizant of that. So they put in a lot of dedicated education time for you to help ease that curve of learning. So we have morning reports every day for 45 minutes. After that, we have bedside rounds where all the attendings and the faculty loves to teach. So we take our time and learn every patient in quite a lot of detail. We also have protected didactic time every Tuesday, and you get lunch during that time. So it's from 12 to 3, and there are a lot of fun lectures. And we also have grand rounds and separate neuroradiology and EEGs on separate days of the week. But I think personally, I love the grand rounds because every day in the morning, you get to discuss the cases that you've seen, and you kind of present it. There are questions asked. Sometimes you think about what more you could have done, and there's like a detailed analysis of your thought process. So you tend to learn a lot. Even with the protective didactic times, they kind of incorporate a lot of lectures in the middle, because that kind of helps you build your basics and you can use it on your daily basis. So to cover it in better detail, I'd pass on the slides to Dr. Tarsaria.
Hi, everyone. Good evening. My name is Karan Tarsaria. I'm a stroke neurologist here, and I'm also the curriculum specialist for the residency program. I'm a former resident myself. I finished my fellowship and been back for 3 years now. So I'll give you an overview of our education. As Pooja mentioned, there's kind of tons of teaching throughout, starting with the morning report every day, the bedside rounds when you focus on each cases. Our protected time is Tuesday afternoon, which is when we have our formal didactic sessions. As we mentioned, this is a protected time for the residents. So the stroke pager is covered by our APPs on the stroke service, and the attendings themselves attend to emergent consults, for example, to ensure we can have uninterrupted teaching. We have multiple subspecialty lecture series that we cover throughout the whole year. What we have continued to work on is provide more hands-on teaching with different workshops performed in our sim centers, including Botox injections for migraine headaches, for movement disorder, hands-on neuro-ophthalmology workshops, for example, and we kind of continue to expand these lecture series. We also have dedicated board and right review lecture series. All of these are kind of covered throughout the year in our Tuesday didactics. Besides that, we do have our Thursday morning grand rounds, which incorporates a case presentation, usually by one of the PGY2 or PGY3 residents every week, and that's followed by a speaker that presents formal grand rounds that usually involves department faculty or invited faculty to present on different topics. In addition, we have a radiology conference every Wednesday where we discuss some of the imaging and certain cases on our service, and it's very helpful for a lot of our junior residents to kind of get helpful tips and tricks about, how do you interpret some of the neuroimaging nuances and get more comfortable. One of the things that we have incorporated starting this year is also EEG review every month, where we again kind of review LTM cases where patients who are on our service, where we're treating them for certain conditions, we can have real-time learning with the interpretation of EEG as well. There's a separate outpatient clinic lecture series, which is coordinated with the outpatient clinics at UConn, which focus on more kind of outpatient treatment topics, for example. But this kind of covers all the depth and breadth of the different topics that we, cover in our education throughout the whole year. We can pass it on to the next slide.
Hi, everyone. My name is Dream, and I'm one of the new PGY1s. I went to medical school in Beirut, and afterwards I moved to Boston for a couple of years, and then I matched at UConn. And one of the remarkable things about this program is that right from the get-go, from the beginning of residency, you have your own continuity clinic. We started at the end of June, and I remember my first clinic was mid-July. And you're given your own responsibility for your patients. So you do the whole history taking, the whole neuro exam, you formulate your own differential. And that's something amazing that you get to build from very early on. Now, this is usually every week, no matter what rotation you're on, whether it's inpatient or outpatient. So you get a lot of exposure, and it's surreal to think that 3 months into residency, I'm already building my outpatient formulary, and I'm getting to see a ton of neuro patients. So this is actually one of the most interesting parts of the year. No matter what rotation you're on in internal medicine, you get a half day to see your own neurology patient.
Hi, everyone. My name is Matt Jaffa. I'm a neurointensivist. I did my training outside of the UConn system, but I did stay at the same system for both neurology and critical care at shock trauma and University of Maryland. I am the neurology site director for the residency at Hartford Hospital. So if you do match with us, you'll spend a lot of time working with me on things to do with how your schedule is and your rotations are run at our Hartford site, which you spend a great deal of your clinical time doing. In terms of coming to Hartford Hospital, I came firstly because of what a great amount of pathology we're able to see and that you will all get exposed to. For instance, I'm still in the hospital tonight because I'm placing an elective spine case on VV ECMO. So there's a lot of really cool stuff that you will get exposure to while you're here, and you guys will all get to learn from it. In my part-time job outside of the ICU, I am focused on research, and this is something that everyone in our system and in our residency has an opportunity to be exposed to. So our residents participate in multiple different varieties of research. Some of this research is related to large multi-site clinical trials. Others are smaller physician or individual-led projects on things that we have strong academic interest in. Every year, our hospital and residents put in multiple abstracts to major conferences that are accepted, and frequently our residents are asked to give presentations of those abstracts at the conferences. The faculty across both the Hartford Hospital, UConn, and even our St. Vincent site are all also participating in presentations at national and international conferences. So there's a lot of great opportunities for all of you who are interested in coming to our program, and for those residents on this call who haven't yet had the opportunity to participate in research, to reach out to us and go through all of the different research opportunities that exist.
And this is Daniel Asad again. Thanks, Dr. Jaffa. Speaking of multi sort of site trials, some of the papers, there's like so much to choose from in terms of the research that our program does, especially our residents when they got involved with. There's just a couple of papers that I thought we could highlight. One is, of course, one of the trials that Dr. Jaffa was also a part of, and Dr. Mehta with one of our former residents, Dr. Kurtapalli Niharika, who as a PGY4 was a named author on this JAMA publication. And then, of course, we also had this platform presentation at the ISC, one of the largest studies on cervical artery dissection, where I myself had the pleasure of working with one of our excellent chief residents, Dr. Balabhadra Anvesh, and two of our medical students who were named on this paper in the journal Stroke. These are just some of the examples of the extent of sort of national exposure that some of our residents get because of the amount of, as Dr. Jaffa said, the volume of pathology and the robust sort of interest in research that many of our faculty have. In fact, all the faculty that I'm seeing on the panel here, Dr. Asaria, Dr. Schuyler, Dr. Eugene, Dr. Jaffa, everybody presents multiple, residents collaborate with them to present multiple posters throughout the year in different conferences. So we are very, very proud of that aspect of our program as well. Next slide, please.
Good evening, everybody. I'm Marie Eugene. I'm a neurologist and epileptologist at UConn or UConn Health. I did neurology residency at UConn and graduated probably, I think, about 15 years ago. I did epilepsy fellowship, and then I came back. I've been on back as faculty for 13 years now back at UConn, and I wanted to come back. It was a nice place to grow up. And when I did come back, it's kind of a hard place to leave. I've had really great mentors, both in neurology as well as other departments in the UConn family. I was the neurology clerkship director for almost a decade, and I'm currently working in the Office of Clinical Medical Education. We have great, wonderful sets of residents who inspire our medical students, and really we graduate a really amazing set of medical students, and those that go into neurology actually really stand out and shine, which makes me proud and makes our program proud. So with that, when it comes to residency and medical student education, the involvement of our residents is paramount. A lot of the time that students spend on the floor or on the wards is with the resident. And so if students are interacting with and exposed to neurology residents who are enthusiastic, who like neurology, who enjoy teaching, that's probably 90% of our job right there. As we're, as a whole community, the neurology community is trying to increase the pipeline and really get medical students interested in neurology. And so I can't say it enough how important a role the residents play in that. So there are a lot of the teaching opportunities are, you can say informal, right? So at bedside or during rounds, when the students are interacting with you as residents. There are formal opportunities for interested residents to teach in our conferences along with faculty members. We have a dedicated chief resident who's in their PGY 4-year, who's focused on medical student education. So students who want to know what research projects are going on, I link them up with that contact chief resident who then has a communication, who then communicates with Dr. Assad or other faculty members. I moderate the student interest group in neurology, one of my passions, and that's really very much student-led. And we hope you join us. And if you do join us, we hope that you have a passion for education. Thanks. Next slide.
Hello, I'm Matthew Mashaiki. I'm one of the PGY3 neurology residents. We talked a lot about the residency program, the training, which is, your main focus of being there, but obviously intermixed with all that, you need to keep up with your mental health, your wellness. So that's something that we have here. One of the PGY4 residents kind of becomes the chief of the wellness for the program, and we have some money set aside for those types of events. We have a number of different types of events that we've done. We've done holiday parties for like Halloween, costume parties, things like that, Christmas parties. There have been intermixed with other types of things. We've had axe throwing, bowling. We did pumpkin carving, which I was robbed of my first place trophy, but that's not, something else. But so it's something that we spend a lot of time on, I think, and especially during, like it says here, that we have these wellness events that are done in lieu of the didactic session quarterly, and it's a nice time just to break. You're spending time with all the residents, and then you're doing something fun. Sometimes we do like neurology trivia, but it's still kind of learning, but still. But we can go to the next slide there. This slide is just some pictures of things to do in Connecticut. If you need my Connecticut bona fides, I was born in Hartford Hospital, so I know a little bit about it. Some of the pictures here, one of the pictures on the left is Elizabeth Park. It's actually the country's oldest rose garden that's publicly available. It's really pretty. It's really nice to go through. Even when the roses aren't blooming, it's nice to walk through. There's a nice little lake. UConn basketball is huge, obviously. The champions, we always will be. So that's always something you can kind of get yourself involved in. The West Hartford Reservoir is a nice area for hiking. There's a lot of different areas for hiking and kind of nature trails here as well. There's some pictures on there. I think that's Mohegan Sun. But there's two casinos, but Mohegan Sun and Foxwoods. Foxwoods used to be the largest casino in America, and then somewhere in Oklahoma they did a renovation, and now they're the biggest. But they do lots of events there. There's concerts, there's comedy shows, all sorts of different things hosted in those areas. Not to drive down there, but pretty big variety of things. There's always these small local things. There's like an apple festival coming up somewhere nearby. I saw some signs for, which are really nice. But yeah, we'll move it on to the next slide.
Hi, I'm Stephanie Alessi LaRosa. I'm a sports neurologist, the director of the sports neurology program at Hartford Hospital, and former resident of UConn Neurology. And I'm the program director for one of our fellowships in sports neurology on this slide. So essentially, there's a number of fellowships that we offer, and it's always great to have an internal candidate. So plugging that. So if you do residency here and you are thinking ahead about fellowships that you're interested in, sometimes it does help to do residency at the same place. So we offer vascular neurology fellowship, neuromuscular, neurointerventional, headache, movement, sports, epilepsy, and we're always working on adding more. And so the next one that's sort of on deck is the neurocritical care fellowship. And I will say about the last slide in Mohegan Sun, you can be seeing me there working events ringside as a sports neurologist. So I spend quite a bit of time at the casinos covering live events. Next slide. And, you know, really, this is just sort of the fellowships that our class of 2024 and class of 2023 have matched in, just to get a flavor. I'm not going to read them all, but just to get a flavor of, you know, where our graduates do go on to in the various different subspecialties, and which institutions that they do end up training in fellowship at.
Thank you, Dr. Alessi. I'm Tina Lender. I am the program coordinator here. I have been in this department for almost 10 years now, so that's a lot of recruitment seasons, but they're always fun. I'm just going to very quickly go over what it'll look like if you do decide to accept an interview invitation from us. So if you do, you will be invited to 2 social events. They are optional, but very highly recommended. So you're able to kind of meet our residents and see what it, you know, catch the vibes, see what it's like. Wednesday night, there's a social Zoom with some of our residents. We try to get one from each class. That way, if you have, you know, different questions about different years, we have somebody there who's kind of the current expert in that. And also on Thursday morning at 7:30 Eastern time, we have Grand Rounds. That's going to be a 30-minute resident presentation. They're going to present a case, and then there's Grand Rounds after that, which will be either one of our faculty or a guest speaker. When it comes to the interviews themselves, we offer 2 different days and times. That's just because we know everybody has different schedules, different time zones. So we try to accommodate those. So there's either interviews Wednesday night in the evening or Thursday morning, and you'll meet 3 to 4 of our faculty. One will always be Dr. Schuyler, of course, and Dr. Greenfield, who is our chair, is also very dedicated to the recruitment process, and he goes to about 99% of the interviews. So you will likely get to meet him as well. So that's basically what you can expect from our interview week. And if I could give a little advice, most of the programs are going to be going to Thalamus this year for scheduling. And I just put the link up there for their trainings. I've been through a lot of them and they're great. So if you do go through those, that might, you know, that'll make you a little more confident about, you know, getting your invitations and getting on your phone really quickly and accepting them. So that's just my little plug for doing the training first. And then these are just all of the ways you can find more information about us. And I think I'm going to turn it over to Dr. Schuyler again.
Great. So thank you, Tina. So Tina is like the face of our program. She will be the one, you know, basically, you know, coordinating all of our interviews and really, you know, navigating everybody through the process when they're doing their interviews. So, you know, it's a big job. We get a lot of applications. So, you know, just definitely appreciate everything Tina does for our recruitment. I just wanted to thank everybody for their, you know, just giving your so much helpful information about our program. I love hearing the, you know, anecdotes from our own residents about what they like to do outside of work and a lot of the wellness activities and other things that they're involved in. I just wanted to highlight a couple things. It was brought up in the chat a little bit about the application process. So as you know, yeah, you're probably working on your ARS applications right now if you haven't completed them already. So this year, adult neurology has 8 signals, whereas last year was 3. I think that will affect how a lot of programs are going to be screening their applications. It really gives us an idea as programs who is very interested in our program. So if you have an opportunity to let 8 programs know that you're very interested in them, then we will take those signals very seriously and you know, really take a close look at those applications. Same thing with the geographic preference. If we know that you have a particular you know, interest in living in this region, your friends or family in the area, that's always really important to try to match in a program where you're near your support systems. So, you know, geographic preference is also something that if you do have a geographic preference, to make sure to state that on the application. If you do not have a geographic preference, then there's an option for no preference, and that's not held against you either. So, you know, just definitely on your applications, we encourage you to just be yourself. We really want to see, just kind of, what you're enthusiastic about, what motivates you, what are your goals, what are your, interests, what do you think you'll want to do during residency after that, based on some of the activities you've been involved in so far, and really think about your application in terms of, sort of a introduction to who you are that we will use during our interview. So the information that you put in your application, our faculty, when they are interviewing you, will be using your meaningful experiences, your hobbies, topics you write about, things you've listed in your CV as topics of conversation and things that we'll want to find out more about you by talking about those things. So definitely, make sure that you are describing things in your application that you'll want to discuss with us in an interview. In terms of our international medical grad applicants, just we do holistic review. We do not give preference in particular to any applicant type. As you can see from looking at our website, we have American medical grads, DOs, US IMGs, and non-US IMGs all in our program. So we are just really looking for putting together a diverse and well-rounded class that are all enthusiastic about neurology and will all bring different aspects of their training pathways, and bring that to put together really an amazing culture that we have here in our program. So just in terms of IMGs in particular, we did just record a webinar, which is 90 minutes long, specifically giving advice for international medical grads applying to neurology residency. So I encourage you, we actually, some of the same residents that are here tonight help with that webinar, gave some amazing advice to our IMG applicants. And I think that would, it'd be great if you can review that as well. There's a lot of helpful information. We've actually recorded one for the last 4 years. So if you want to watch more than one, feel free. I think there's a lot of helpful information in those. So I'm just skimming through the chat as well. Just in terms of that, we have tons of mentorship programs. So we have a peer mentorship program. We have multiple faculty mentorship programs. And obviously outside of formal mentoring roles, our faculty are very approachable. So if you are, let's say, potentially interested in epilepsy fellowship, I think there are 14 or 15 epileptologists on faculty. So there are a lot of faculty that you could just kind of pop in, ask them advice, talk about their pathway, where did they train, just get advice about what it's, what are their areas of interest within epilepsy. And I'm just giving that as one subspecialty example because I'm an epileptologist, but I think all of our faculty are very open to providing help and guidance and mentoring to any of our students or residents or fellows who are looking for some career advice. So you don't have to only just get your mentoring from one assigned person. The other, I'm just skimming through some of the other questions here. So opportunities, so just in terms of filtering applications. So it depends what you've done since you've graduated from medical school. So that's something that you need to document in your application. So if there have been a number of years, it's important for us to see what you've been doing in that time. So we don't filter out specifically by a graduation date, but if you haven't just graduated, we do want to see what you've been doing. If you've been involved in clinical work, many of our trainees in our residency program have done some residency training in their home country. And so that actually, that gives you additional clinical skills that our medical students just graduating don't have yet. So in some cases, having some additional time after you've graduated from medical school can be really helpful just in terms of your preparation for residency. So we don't have sort of an absolute cutoff for graduation year. It really just depends on what you've been doing clinically since you've completed your medical training. And then in terms of second looks. So I don't know. So our recruitment is all virtual. And that is really to keep everything fair and equitable and to not put pressure on anybody to feel obligated to come and visit. You're free to visit, the Hartford area, kind of take a look around, but all of our second look visits are virtual. So we usually at the end of the year, when we've completed our interviewing, we will have a couple of sessions which are on Zoom, which we allow you to attend some of our didactic program. We do additional, Q&A sessions with our residents and faculty to get your questions answered. But we do stick to the guidelines that, we want to keep everything all virtual, for the, from an equity perspective. So I think I'm going to end on that note. Dr. Asa, do you have any other topics that you don't want us to miss in the session today?
Yeah, I think like one little thing that I just wanted to sort of focus on, which I don't know if you were able to hammer home the point, is that in terms of the research opportunities that people have, one thing that I wanted to focus on was that all residents get now an IRB protocol editor as well as a statistician to help them with their research projects as well. And that is a big sort of help for a lot of residents. I know some residents on the call have been working on projects, including Anvesh, who has done a lot of research with me. And just wanted to tell you that there is a lot of support for, a lot of residents who want to pursue some research as well. Of course, like residency in general, and our program is obviously heavily clinical, and that's because of all the ACGME training requirements. But if you have to do that, that is one thing that I would really want to highlight about our program as well, that there is a lot of support for research if people want to want to do that. And the other one last thing that I wanted to say is that on the inpatient stroke service, there's a lot of support from the APPs as well. So you will see that residents do get to enjoy a lot of time to learn cases as well and not be overwhelmed with any volume or anything like that. So those were some of the highlights that I also wanted to sort of just touch base on, but nothing else other than that. I think we covered most of it, and I hope you guys see why we love our program so much. Dr. Skylar, any closing remarks? And then I think
I just wanted to wish our applicants luck with this season. I know it can be stressful, thinking, and kind of overwhelming thinking about, this whole process kind of looming, but hopefully you can see by visiting some programs that we are hopefully, very approachable. Neurologists are nice, nice people to work with. We're really excited that you've chosen neurology as a specialty. And I hope that you can use the application season as a way to kind of network, meet a lot of faculty, meet a lot of residents, meet a lot of other applicants who you might end up in the same program with or getting to know at some point during your training or your career. It's a great community. The neurology residency programs as a whole are excellent. So you're going to get outstanding training almost wherever you go. So it's really a question of finding what program is the right fit for you in terms of geography, in terms of size of program, where you'd want to live, what subspecialties are offered in particular, what fellowships they have. So really, do your research up front, but, kind of think about what's important to you. But don't worry about whether or not you're going to receive a quality neurology education because our programs do a great job with that. So just want to wish you all luck in the process. And I look forward to seeing everyone's applications.
all right. Thank you so much, everyone. Thank you for joining, and we'll see you on interview day. Thank you. Bye-bye.